Hi everyone, my name is Harish. I'm one of the officers in the academia team in Intermed School. And for this month's clinical case, I'm going to be talking about eczema. Now, eczema is one of the most common conditions that you'll see in general practice. It's certainly one of the most common skin complaints. So I thought it would be useful to kind of cover some key ground on this topic and give you a sense of what it is in advance of going to med school, and it's certainly something you'll encounter further there. So I'll talk very briefly about what it is, talk about some of the key risk factors for it, some of the ways in which it presents, and then we'll round off with kind of how you'd investigate it, treat it, and manage the condition as well. So in terms of your prior exposure to this topic or to this condition, I'm expecting that it's not something that you'll really have investigated in any great depth in your current studies, because dermatology is a pretty specialist area of medicine. But it would be helpful if you had some understanding of kind of just how common skin complaints and skin conditions are, certainly in general practice. But no specific knowledge is required for this case. Okay, so what exactly is eczema? I suspect it's something that you've heard of before, or most of you will have heard of before, but to put it into words and to articulate it is actually quite tricky. But essentially what eczema is it's an inflammatory skin condition that causes these patches of skin that are dry and itchy. So those are some of the key defining features of eczema. If you see someone presenting to the GP surgery with patches of skin on their sort of elbows or on their hands that's very dry, that's constantly itching, you're thinking this is potentially eczema. What are the key risk factors for it? So family history is one of the most important risk factors. So if you've got, say, parents who have eczema, it's much more likely that you would develop eczema than someone who doesn't have any kind of family history of the condition. It's linked to other conditions like asthma and hay fever. So again, if you've got some of those conditions, they're seen as like a triad of conditions, so it's more likely that you'll have eczema. And then it's just the more common things that you might think of. If you are stressed, more likely you'll have a flare-up. If you use any kinds of chemicals that come into contact with the skin, it can irritate the skin, potentially exacerbate eczema. Environmental factors are really important for people who live in the home with companion non-human animals. Hair from these animals can be a trigger. Being in the cold weather can also be a trigger. Allergies, food allergies. So there's a whole bunch of different risk factors for eczema. And we've already kind of briefly spoken about what the key symptoms are. But essentially, the main symptoms will be focused on the skin. There'll be this dryness, as I've mentioned in the previous slide. There'll be the itchiness of the skin. Sometimes the skin can also crack. But it's important to realize, although this is a skin complaint and there are these sort of manifestations on the skin, it can cause other issues too. So if you're constantly itching, for example, you can imagine that that's going to affect your sleep. You might be tired, you might be fatigued, you might not get a good night's sleep. It can also affect your day-to-day activities. Sometimes the eczema can become so severe that you're not able to sort of carry out things like cooking or walking, doing the things that you might normally do during the day. Also, that area of skin could potentially become infected, and it can become something more serious. There's a condition called eczema herpeticum, which I won't go into here, but it's effectively where there is sort of an infection that is very serious and needs to be treated immediately. So you can see that although it might seem like it's just dryness or itchiness, it can really affect people's lives in very significant ways. So someone's come in with eczema. How would we be investigating these patients? How would we kind of confirm our diagnosis of eczema? So really, eczema is a clinical diagnosis. And what that means is that you don't need to do any special tests. You don't need to look for some special marker in the blood. Effectively, the most diagnoses of eczema are made by just examining the skin and taking a history from the patient. So the patient will complain, as I said, about that maybe they might have these other conditions like asthma, hay fever. They'll be complaining about the itchiness, the dryness. You'll examine the skin, and on that basis, you'd make the diagnosis. But of course, you always want to do some additional investigations just to rule out other things. So you might do blood tests, see if the patient has a more chronic condition, potentially an autoimmune condition. You might look for certain markers in the blood of inflammation. You can do a biopsy of the skin if you're suspecting maybe skin cancer or something like that. So you always want to rule out other things, even if you suspect that the most likely cause of the patient's symptoms is eczema. Okay, so you've patients come in, you've taken the history, you've examined them, you've diagnosed them with eczema. How do you go about treating these patients? So the first thing you want to do is maybe try and offer some psychological support. This is obviously not necessarily addressing the skin complaint itself, but it's really important that people have the appropriate support in place. So you might refer them to a support group or something like that. And of course, as we spoke about earlier, stress can be one of the significant sort of factors in flaring up eczema. So psychological support is a way of kind of keeping that in check. In terms of specific treatment for the actual eczema, emollients, so basically moisturizers, are very important. They're one of the most important ways in which you manage it on a daily basis, keeping that area moist. So obviously eczema is characterized by this dryness. If you can keep the area moist with emollients and moisturizers, that's going to try and relieve some of the symptoms. Steroids are a very, very important part of the treatment as well, particularly for resistant eczema. So maybe the moisturizers aren't helping to clear up the symptoms. The patient's continuing to report this dry and itchy skin. Topical steroids have a very important role to play in reducing that inflammation. If you remember from one of the earlier slides, we talked about eczema being an inflammatory skin condition. So topical steroids help to reduce that inflammation and then subsequently relieve some of that itchiness and the dryness. And then if even steroids aren't working, there are more significant kinds of medication that you can use called biological therapies. I won't go into that here, but just it'd be interesting and important to note that that's also part of the treatment pathway if the moisturizers and the steroids aren't working. Okay, so in terms of the key takeaway from this case, I would say that one of the most important things to take away from this case is understanding that there are various different triggers for very common health conditions. So if you remember the slide earlier in this presentation on the risk factors for eczema, we talked about family history, we talked about environmental factors, we talked about chemicals, we talked about food allergies, we talked about psychological states like stress. So this whole host of triggers that can really flare up and worsen and exacerbate common health conditions. So that's something to definitely bear in mind as you progress through your medical career. And that wraps up this month's clinical case on eczema. Hope you found it interesting and informative, and I look forward to presenting next month's case. Hope you all have a good month in the meantime. Thank you very much.